Stomach bugs are always unpleasant, causing days of digestive discomfort that can leave you housebound. While the exact cause is often unclear, thousands of cases in the UK each year are due to eating food contaminated with E. coli. Although it's impossible to completely avoid exposure to harmful strains of E. coli, you can equip yourself with knowledge about symptoms to watch for and tips to reduce your risk of infection. What the best ways to protect yourself? What is E. coli? Escherichia coli, E. coli, is a type of bacteria commonly found in the intestines of humans and animals and is excreted in feces. Most E. coli strains are harmless, and many are beneficial for digestion, according to Dr. Alex McCarthy, a senior lecturer in the Department of Infectious Disease at Imperial College London. However, some E. coli strains can cause illness. In the UK, most intestinal E. coli infections are caused by Shiga toxin-producing E. coli, STEC 0157, says Alan McNally, a professor of microbial evolutionary genomics at the University of Birmingham. Recently, an outbreak was linked to the STEC 0145 strain, which is relatively uncommon, and allowed the UK Health Security Agency, UKHSA, to identify it as an outbreak. Symptoms of an E. coli infection: stomach cramps, diarrhea often bloody, nausea and vomiting. Typical symptoms of a STEC infection such as diarrhea, stomach cramps, and vomiting usually appear within 3 to 4 days of exposure. Blood in the diarrhea is a strong indicator of a STEC infection, says McNally. Can E. coli be fatal? In severe cases, a STEC infection can cause blood clots that may be fatal. This occurs when Shiga toxins damage blood vessels in the intestines, leading to clots that travel through the body, explains McCarthy. If the toxins reach the kidneys, they can cause hemolytic uremic syndrome, HUS, and kidney failure, which can be fatal. While most people will not suffer severe infections, young children, the elderly, and immunocompromised individuals are at higher risk. High-risk situations: back pain, blood in urine, severe fever. If these symptoms appear, seek medical attention immediately. Sources of E. coli: food contaminated with manure, petting farms, contaminated water. STEC is commonly found in the intestines of animals like cows, sheep, and goats, and doesn't typically harm them, says McNally. However, if manure from these animals contaminates food, it can infect people. This can occur during food processing, such as when meat or dairy products come into contact with animal feces. Raw or undercooked meat and contaminated water used to irrigate crops can also spread E. coli. Historical outbreaks like the one at a butcher's shop in Wishaw, Scotland in the late 1990s were linked to poor hygiene practices. More recent outbreaks have involved prepackaged salads and processed foods, which are challenging to trace back to the contamination source. Is E. coli contagious? E. coli does not spread like COVID-19, but it can be transmitted via the fecal-oral route. This occurs if an infected person doesn't wash their hands properly after using the restroom and then handles food for others. The UKHSA notes that E. coli can spread in families, nurseries, schools, care homes, and hospitals. Preventing E. coli infection: wash hands regularly with warm water and soap. Wash fruits and vegetables and cook food thoroughly. Avoid preparing food for others if experiencing diarrhea and vomiting. Stay home for 48 hours after symptoms stop. Use disinfectants to clean surfaces. While only a small number of people get sick from contaminated food each week, taking precautions can reduce your risk. McNally advises washing all fruits and vegetables, even pre-packaged salads, and being cautious with unpasteurized dairy products and raw milk. Treating an E. coli infection: if you see blood in your stool, contact a doctor to notify the UKSA. While diarrhea can be unpleasant, it often resolves on its own without treatment. It's important to stay hydrated by drinking small sips of water frequently and eating solid foods when possible. Rehydration powders from a pharmacist can also help. If symptoms persist for more than a week, seek medical advice. Antibiotics are generally not prescribed for STEC infections as they can cause the bacteria to release more toxins. Stomach bugs caused by E. coli can be severe, but understanding the symptoms and sources of infection can help you protect yourself. Proper hygiene and food safety practices are key to reducing your risk. If you suspect an infection, seek medical advice promptly.